Hello and welcome to the Texas Mind Exchange podcast. I'm your host, Cody Gould. Today, we spoke with Peyton Wagner and Matthew Gonzales of the Hays County Health Department. We talked about the current state of public health in Hays County. We talked about what a health department is and who they serve. We also talked about the future of public health and mental health in our community. So without further ado, welcome to the Texas Mind Exchange. Just as a reminder, all statements expressed by our guests on this podcast are their own and should not be considered official views or opinions of myself or anyone else at Texas State University. I know that as the Translational Health Research Center has been wanting to do more community outreach, obviously that's my role. Talking with you all, I didn't even know what the health department was. I mean, I grew up in Maryland. Mm-hmm. Don't know what the health department system looks like in Maryland.
Yeah.
And then moving down here to Texas. And when I moved down here 2015, and when I went to Texas State, I don't think people really interact with a health department at all. So when we think about, I guess I would love to start with helping the audience understand what a health department is. What do you do? Why should people pay attention, especially if they live in Hays County and potentially outside of Hays County? But why do people need to know about what a health department is?
Yeah, it's such a good conversation. I kind of liked your explanation of coming from Maryland, right? Because there's a lot of different, practices for public health and the organization and structure. And I believe Maryland's a centralized state, which means that the state and local units share joint funding and kind of cooperate with one another a lot more seamlessly. In Texas, we have a decentralized state, which means that the local authorities are locally paid for and locally controlled and operated. The state maintains, their authority and have some communication, but ultimately the local jurisdictions can make the decisions they need to for themselves. I think that's kind of, the Texas mantra, right? Nobody can do better than the local governments themselves. For our Hays County Health Department, what we really want to communicate to people is that we're here during times of not emergency, I guess. So states of normality, but then also we're there during times of emergency, and we're all parts of that emergency cycle, whether it be the response, the preparedness, the mitigation or recovery efforts. The health department's there through it all. So our health department really helps out with a multitude of things, and that only recently changed. The majority of it primarily being infectious disease. What most people think of a health department, they think of Zika, West Nile, tuberculosis, STIs. And our health department does address those things, but we've also started addressing a little bit more. And I think that's kind of the key thing I want people to start paying attention to whenever it comes to local government and public health and their local health departments, is that each one is so uniquely different and it can be shaped by their community, but their community, one, needs to engage with that health department so they know where to or how to shape it and what their needs are. But then also that they can be familiar with the resources that it provides, because we provide a lot of those resources. Mm-hmm. I think so. Peyton's new, so I kind of want to see her perspective about that. Let's hear it.
Well, similar to you, I think I didn't have a full understanding, and this sounds bad, but of just how essential local government is before working in local government. Whenever elections happen, everyone thinks about just the presidential, but just now having spent so much time navigating and learning local government, it's so important. And even if my career leaves local government, I'll never not be this invested in it, because it really does shape so much. I think when I thought of health department, I would always think of the clinic side. But we also, I've come to see how the health department can really be a facilitator for dialogue. Matthew always says we don't have to have the solutions for all the problems, but bringing people together, giving our community the tools to address some of the health issues we have from that framework. So I've been I think that's what I love about this job is you can do so much, and you public health is everything. It's everywhere. And so that allows a lot of creativity, a lot of room for great partnerships. And you can do a lot.
Yes. Yeah. Yeah. And I want to go back to what you were talking about with, infectious disease. And that's usually what most people think about. I know we're focusing more on mental health within this podcast specifically, but I know that there has been a lot in regards to infectious disease on your plate more recently with measles, and was there some TB stuff going on?
Yeah.
And I guess I would love to see how, like, does that impact what your kind of approach to mental health is in any way? Are those things connected, or are they totally separate?
Yeah, so I am a new public health administrator. I only graduated college in 2021. So kind of coming into this, I had this new concepts and ideas of what public health looks like in this current day and age. So from my perspective, things have always been looked through a health equity point of view, which a lot of health officials are aware of, but it was kind of some newer language and new terminology. And for me, I can recall COVID happening, and that's kind of when I interned with the health department. And that was kind of my first, interaction or partake in emergency response within a health department. So we clearly recognized that individuals were going to have distress with mental health. And that always stuck with me, is that COVID led to the epidemic of loneliness within the United States really skyrocket. So with that in mind, almost every, for instance, there was the monkeypox situation that had occurred. We took the health equity lens, kind of looked at our responses on how what we communicate can impact the mental health of the victims of monkeypox and or those who are immune affected. During that little epidemic situation that was going on here within Central Texas and the growth of monkeypox, it was very clear that there was a population that was predominantly being impacted, and that was the male having sex with male population. And traditionally, that's going to be, LGBT individuals or gay individuals. So we wanted to make sure that the way that we're phrasing the communications was not going to perpetuate them as somebody who was a perpetuator. They're a victim in this incident, and we need to make sure that whenever our language reflects that for their mental health, but also the culture of our, population. And so I think that's kind of where the behavioral health aspect came into play. Is there's this, mental health is all about, to me, your headspace and the way that you, handle those solutions and those problems. Whereas behavioral health recognizes that it's not just everything inside your head that's happening or the chemistry that's going on, but it's your environment that's also impacting how you react to these situations. So that's kind of what led us to this point, but also illustrates how behavioral health is incorporated into public health and how we utilize it to kind of have a better response and or recovery.
Mm-hmm.
Yeah, I think out of our whole staff, one of the people that was most excited for us to get a peer support specialist was our STI, disease intervention specialist, because she would always talk to people and tell me, afterwards, there's so much fear with the diagnosis, so much shame. Mm-hmm. And so she was like, I need somebody that I can refer people to for that mental health support aspect of getting a sexually transmitted disease.
Yeah.
So.
Yeah. I would imagine that could, help, not help, but that could perpetuate a crisis if somebody's going through it. There is a lot of negative emotions that are associated with stuff like that.
Yeah.
That's interesting. And so just peer support is what y'all work with, or do you have therapists and counselors on
staff? So we want to eventually get
Mm-hmm.
to the point where we can do direct services. Right now, I'm kind of the main solo role for behavioral health, and also getting creative with programmatic funding and finding that. So we did start peer support, and that has been through a partnership with Via Hope. So we have one peer support specialist who is working on her certification, and she gets hours. So we've kind of been doing a pilot, and it's been going great. I think she's been a really big connector and bridge a gap across the county department. I mean, I think departments normally work in silos, and now we're having a lot more increased communication with our judicial services, and they're learning about our indigent care services and connecting that. And so it's been great to see how that role can span across the continuum of somebody's health and follow them at every journey. Because when you work in silos, you get caught and you don't know what resources are even out there.
Yeah, I would imagine that probably the people that are coming to the health department might not know where to start.
Yeah.
And the health department seems like a perfect place to start. And you guys are connectors of different initiatives and different kind of organizations that are out there.
Yeah, a good example of that, kind of that idea. Most people think of a health department whenever it comes to like issues that they're experiencing. Was a resource that we launched last year, which is the resource guide. And so that resource guide is kind of a culmination of different topics: transportation, food,
healthcare, substance use,
so
healthcare.
A whole bunch of these sources that again tie into that idea of behavioral health, where your environment is shaping the conditions of your mental health. And so the idea was that if we can help connect these people to their resources, the mental health of our community should improve. And so the goal is to continue to expand that resource guide through different things. I think this year, very early on, we thought, oh, hey, maybe we should add a new mother section, like a maternal health section, where for resources for individuals. We thought of some for aging residents, some of the elderly population. And so we're constantly getting new things of like, oh my goodness, we didn't think to add that resource. So it's constantly expanding. And then I think this summer we're getting ready to launch the Spanish version of the resource guide. So there's a large population of our residents, specifically in the east side, but also on the west side, lower income communities who are predominantly Spanish speaking. So we're super excited to get that launched, of where, they have a resource that whenever they call us, it's like, hey, don't worry, we got you.
Yes. And shout out Texas State's World Translation Department. They're the ones who helped us get it translated. And so it was amazing. The professor I worked with was like, we're always looking for real world translation experiences for our students. So we'd love to help. And so it was fantastic.
Yeah. Talk about the community coming together.
Yes.
I think that's something that Peyton and I really have harped on with public health. It was real. I started with the health department again as an intern, limited resources. It was COVID, so there was a little bit more resources. But then I came into a program management role for health equity. But it was there that I realized, oh man, like there really is a limited budget. And then I don't think it's evident enough to people, but there is a lot of red tape in government. I know everyone hears that, but until you experience what it's like, I don't think you understand the constraints and conditions in which we have to operate. And so that red tape really left me having to think uniquely about how do I get this program up and going. And I really came down to, we have partners and we have policies. And we can always engage with partners and we can always change policies to create better programs. And Peyton, being the one-man army that she is, has really took off with that in the behavioral health space. And so that partnership is a good example of how or what products come out of it whenever, community members help one another.
And I would love to use that to transition to partnerships and talk more about like how you ingrain in other organizations that are around town. Because I mean, Hays County is an interesting county, being sandwiched in between Austin and San Antonio, being potentially part of a lot of like either Bexar County or Travis County Metroplex. And like what are the challenges in our area? Are they unique to us, or are there like mental health specific things that we're seeing, or physical health specific things that we're seeing? Like what do we think? Well, let's start there, and then we can go on to like how we ingrain with other organizations.
Definitely, I think it is a blessing and a curse to be stuck in between. I think one of the first things I did when I got in this role was I researched a bit about Bexar County's behavioral health, Travis County too, to see what they were doing. And I think there are they've kind of paved a way, but then trying to make it fit our community needs, because it is not feasible to send people that far away to get resources. Transportation is one of the biggest barriers. And Matthew can talk a little bit about, we did a community health needs assessment to see what our Hays County residents were experiencing. And I know transportation was major.
Yeah. And kind of just to go off of Payne's, conversation, is there's 254 counties in Texas. And I don't think you'll ever see one or two that are exactly the same. And I think some residents, though, kind of have that expectation of, oh, you're right in Austin. Why don't you have the same resources out there? Or why doesn't your government, work the same as Travis County or Bear County? And so it does place a little bit of a expectation and burden on us as Hays County, because it's like, you are just as large and you're right there by Travis County. Why don't you have the same resources? But obviously there's the challenges of a county growing, for the last few years. I mean, I want to say at least decades, 2 decades. Hays County has been one of the fastest growing counties in the nation, and in Texas. And so what that means is our services have a delay or lag in meeting the expectations of residents, because we have to have that infrastructure built, but it's never going to be built just in time. And so when it comes to that discussion of, how is it a little bit different, kind of like Peyton said, we at least get the blessing of, everyone says hindsight's 2020. So we get to kind of learn those lessons of Travis County and Bear County and these larger, cities or counties, and how they implemented their programs. So that way we don't have to make those same mistakes, and we can integrate it early on. I think something early that happened in mine and Peyton's discussions about this program was Bear County.
Yeah.
Bear County was like, I am so happy that y'all created this program within the health department, because for years, it was a standalone department that kind of just operated, and it didn't have too much coordination or resources. Like, they've made amazing changes, but they're like, there was something else that we're missing, and they couldn't really find it until recently. They're like, the health department. Why don't we have it in the health department to connect everybody? And so they were really amazed that we made that decision early on to implement this program here.
And the program being behavioral health.
Yes.
Got it. Okay. Okay. Yeah. And I guess now building off that, when we think about behavioral health, you're a one-man army, which is amazing. You're doing so much amazing stuff. And this is a big question, but like, how do you do it?
Well,
who do you interact with?
I am a one-man army in the sense that I am the sole person dedicated to that at the health department. But I think it's through, and can kind of segue back to the partnership discussion. I mean, our Healthy Hays Coalition. So this is a coalition we have, and there's different work groups to address different aspects of health. So I kind of oversee the mental health work groups. One's a youth and one's for adults. And they have been amazing in helping me move along initiatives. So they're also doing the work. I mean, one of the campaign we did for Mental Health Awareness Month with people sharing their stories, like that's all through partnerships. And so I definitely always have to give credit and shout out to our community partners, like Synacor, the Food Bank, Southside Center. They're the ones also too, like helping me move things along. And it's important that we're listening to them, because they are on the ground doing the work, and they might not have the capacity or the bandwidth to help with some of these more systematic changes, but we have to be a bridge. So being able to listen to them, get their feedback, their ideas, and work that way is kind of, I think that's where I've seen the most success.
Yeah, absolutely. I think that's the biggest thing that we've, as a health department, like whether or not it be behavioral health, our outreach specialists, even our infectious disease team, what we've learned is partnerships are really the key to everything. A good example, on top of everything that Peyton has provided, is measles. Early on, we created a task force of infectious preventionists and also designated infectious control officers within the different emergency response agencies. And so our response to measles, because those partnerships already existed, it was quick. The turnaround to giving the different procedures and protocols for everything, it was like within 72 hours. And so everyone knew what they needed to do. Everyone was prepared. And I think it's truly our capability to have these unique partnerships that's really helping drive this amazing
momentum.
Momentum of results.
Yeah. Yeah. And when we think about the growth of the health department, are there areas maybe besides mental health, because we know we need to invest in that more? Are there other areas that you're looking to kind of really pour into?
Yeah. So, the health department in 2021, when I was here, was a team of 9 people. And 2023, that grew to 17 people. And just now, one of the parts that is growing in the health department is the Animal Welfare Services Division. And so that'll officially bring the department up to 21 employees. That's an area that we're really trying to expand, and we're trying to adopt this ideology of One Health, which is, the health of humans depends on the health of the animals and the environment around them, but also that entire relationship all impacts one another. And so what we really want to do is try taking the core ideas of One Health and trying to develop them into the programs here within the health department. So a good example of that is right now we're only doing infectious diseases. We're not really looking at chronic illnesses. And so, that would be a component that eventually I would want to look at. So that way we can really provide numbers to our policymakers and community members of, hey, these are X amount of individuals dealing with Y illness. Let's understand why that's happening to really get an idea of what may be going on within their environment or work or, or living situation that's causing these results. We actually just submitted our budget for the fiscal year 26, which runs for counties October 1st through September 30th. And like I said, we just submitted the budget. So this budget, we actually requested more staff members for Peyton's program. We requested 2 peer support specialists, and we requested 2 community paramedics. So that's a little bit of the behavioral health, mental health space, but also social work space. I think Peyton can kind of dive in there a little bit how we're trying to expand that.
Yeah. So I guess talking about community paramedicine, that's something that's really been on our minds. We have been looking at programs that will help people get out of the cycle of high 911 utilizers. So I think to be considered a high 911 utilizer, it's people who call the 911 system more than 4 times a year. Which there's a lot. We've just been going through the data. And I think our threshold is going to have to be like people who call 20 times or more a year. So we want these community paramedic individuals kind of with that social work background or skills to be able to meet people when they're not in a time of crisis to kind of get to the root cause of why they keep utilizing 911 when we know that there's maybe a better resource to help their situation, whether it is behavioral health or a chronic disease, or maybe they're a fall risk and they keep falling and they're like part of our elder population. So we've seen, just through research, there's all kinds of programs like these across. And so I think that would be really beneficial. It's also going to help our first responders who are experiencing an overload of calls and their strain in resources. So I really think it's a unique solution, and we're trying to tap into those and ways to address the root cause.
Yeah.
And I think to kind of expand on that, yes, I kind of like let the listeners or viewers really understand the kind of situations that counties sometimes face. Is not every city has a law enforcement agency. Not every city has an EMS, and not every city has a fire department. In Texas, we have what's known as emergency service districts. They're taxing entities that can provide fire or EMS services. And so what we have here in Hays County is we do have that kind of disfragmented first responder system, because say for instance the city of Dripping Springs, they don't have police, they don't have fire, and they don't have EMS. And so what that means is that ESD is going to be responsible for a greater footprint than the Dripping Springs city limits to be responsible for calls out there. So you can only imagine if they're constantly getting calls from, like Payne said, someone with a chronic illness or numerous falls or something of that sort, what type of strain that's putting on the fire and EMS individuals out there in that ESD. So this kind of countywide solution is hopefully not only something that will be able to address the behavioral health needs of our constituents, but also, again, like Peyton said, that first responder burden that we're seeing within our community.
So I guess what I hear is it's not just that we don't have enough first responders. It's that the area potentially is almost too large.
Yes, that can occur. And so, again, it's predominantly just due to the way that our, emergency service districts are set up here, specifically in Hays County. So, yeah, I mean, the footprint can be, large.
Yeah. Yeah, that's interesting. We were just, my girlfriend and I were just out in West Texas and Marfa, and we were talking to some locals, and they were saying something similar to what you're talking about, which is like, if you're in a car accident or you may be a part of the elderly population and you fall or something's happening, like be prepared for the emergency services to take like 45 minutes to an hour and a half. And imagine if you're like riding a motorcycle and you're in a motorcycle accident or something along those lines. That is crazy. But that's, those more rural areas are kind of encountering some of those issues, which goes back to what you were talking about, which was travel and transportation. But then also thinking about chronic illness, which I want to go back to. I have Crohn's disease, which is technically an invisible chronic illness. That absolutely coincides with mental health and mental wellness. And so all these things all are ingrained and intertwined. And I guess as we look holistically at the future of the Hays County Health Department, and you're dipping your toe into, I guess, more chronic potential situations, the mental health aspect seems like it would absolutely begin to rear its head in regards to like, okay, maybe this person has, just use Crohn's disease, for example, like this person has Crohn's disease. Are they, and it's really severe, are they getting, peer support?
Right.
Because like you can only join so many Facebook groups.
Yeah.
Right. Yeah. Like seriously, like that was when I first got diagnosed. They're like, all right, join this Facebook group. Other people are out there that have this, but it's like, no, I need to be going to like a peer support specialist or a therapist to like help me work through some of this. Yeah. I mean, a lot of it is like potentially coincides with anxiety and depression, and like all your entire body is like connected. So when we're looking at these things in completely segmented manner, we're not looking at the human in a person-centered kind of first approach.
Yes.
And I guess like that, I would like to hear your perspective on like, is that the goal of the Hays County Health Department, to look at person-centered kind of assistance?
Yeah, absolutely. I think that is the trajectory of where we're going right now. I think that's a lot of the conversation that you'll hear me as an individual really say. I always tell people this example, and I actually gave you this example whenever I met you and Marsha for the first time, which is the easiest thing a person can do to improve their health is take a walk, right? That physical activity helps their personal physical health, but it also allows them time to process whatever they're mentally going through. So it improves their mental health. And so the solutions that we're wanting to create at the health department is those simple things of, let's have our community be able to walk. Let's have them be able to improve not only their physical health, but their mental health, enjoy the environment, and possibly with a pet, right? So we want all these things, all these conditions to be the best for our individuals or our residents within our community, because at the end of the day, just because your physical health is great doesn't mean that your mental health's not, and vice versa. Just because it's great doesn't mean that your physical health is great. I think the greatest example of us seeing this transition is Peyton and I actually had a meeting last week with our emergency preparedness coordinator to kind of go over how and where do we start implementing behavioral health practices into our preparedness and emergency response plans. So a great example is there may be a crisis that emerges at a school and reunification is needed. How do we, integrate behavioral health into that setting? What does it look like whenever we respond? Are they there first? Are they there with us? When do we need to bring them in? And what type of behavioral practices do we need to start utilizing? We're super excited to start integrating that into there because, again, this is a moment of emergency for individuals. And the last thing that we want them to do is be in a state of mental health that is going to make the situation more exacerbated.
Yeah. That's so interesting, thinking about like the holistic perspective. And what is potentially like exacerbating issues. And does it fall on the health department typically to respond to disasters? Because I know when we had Elisa Ramirez on from the American Red Cross, she talked about a lot of like what it is to respond to disasters and what that looks like. Does that fall on y'all as well?
Yeah, so it depends on jurisdiction to jurisdiction, but traditionally health departments are there for man-made disasters and or natural disasters. So whenever you think of a radioactive spill, right, that ideally should have some component of a health department integrated into it. Another example would be anthrax. The anthrax is something that a health department typically responds to. We typically provide the first doses of medication to ensure that individuals has either post-exposure or pre-exposure prophylaxis, meaning that they get treatment beforehand before they're being exposed to reduce the impacts, or treatment afterwards to reduce the impacts of it. It was the floods. We were a big component during the Memorial Day floods that Hays County is really aware of. Specifically, they were out there helping first responders get the shots that they needed in order to make sure, again, that pre-exposure prophylaxis, tetanus, making sure that any of the debris that they get into is not going to impact them. And then post-exposure for the families who did already start having debris, cuts, bruises, scratches, things of that sort, making sure that they're not getting any infectious diseases. And so I think there was a time period where the health department, and this happens all the time. Like if you look at funding data, anytime you see emergencies, public health funding skyrockets. But then during those times of normalcy, or even during the recovery phase, we see that money just decrease. And so we never see a stable public health budget because of that routine pattern of emergency, no emergency, emergency. So yes, we do. That was kind of a long answer, but yes, we're all kind of there through all phases of emergency response. Again, preparedness, recovery, or response, recovery, and then mitigation.
Mm-hmm. And with Hays County, we do have an Office of Emergency Services. And so we have a specific role in Hays County called our Emergency Preparedness Coordinator that kind of is a liaison between our health department and our Office of Emergency Service. Similar kind of how peer support is that bridge between us and judicial services. I think having those roles to connect intergovernment departments has been super critical. So he plays a huge role in helping with their emergency preparedness as it relates to public health issues.
And a good example of that is actually a meeting that we had last weekend was regarding the homeless population. We were starting to get into conversations of what does heat shelters look like, and or cooling shelters and warming shelters. What does that look like for the homeless population? And of course, through the lens of emergency services, it's like, let's just do X, and that provides
policy procedure.
Service.
Yeah.
Whereas if you look at through a health equity lens, it's like, okay, what are the root causes of the situation and why is it happening and what can we do to mitigate it? But then also for a public health response at the same time, okay, what resources do we need? How do we allocate them? What are other things going into the shelter, such as like infectious disease? How does that, impact situations? In most homeless centers, tuberculosis can be a situation that's detrimental to the health of those individuals. So it's little things like that that we get to be a part of the conversation that people often are like, whoa.
You wouldn't think,
didn't know y'all were part of that. And so.
Yeah, totally. Because, I'm probably not the only person that thinks this, but like tuberculosis feels like old school 1700s bubonic plague type stuff.
Yes.
Which I guess, you see it on a hopefully not daily basis, but
I think it's actually funny. I think everyone has that same response whenever they see the clinic. They're like, tuberculosis, like y'all still have tuberculosis, like we still have that. And then whenever we tell them, oh yeah, like we have a patient, they're like, I have a patient. And of course it is alarming, right? And unfortunately, I think it's going to become normal for other individuals and counties. What we're seeing is a increase in cases of tuberculosis across the nation. But we're also seeing an increase in the state of Texas. And so what that looks like for us specifically is, say, for instance, in 2022 or 2023, we only had 3 cases of tuberculosis, which is pretty average for our county and a county of our size. In 2024, we experienced 10 cases of tuberculosis, which is tremendous. This year alone, we're just finishing the first quarter of the year, and we're already at 3 active or 4 active cases. And so, it's definitely something that has its repercussions, and it's a very thorough investigation. What I like to tell people is TB is a slow developing disease. A lot of people who are exposed to TB may not even ever get TB. There's two kind of classifications. There's latent tuberculosis infection, which is you have it present within your body, but you're not symptomatic, nor are you able to transmit the disease to other individuals. And then there's TB disease, which is active TB, meaning you are dealing symptoms from it. You're also capable of transmitting it. Typically, it's night sweats, loss of weight, fever, a whole bunch of other situations. The cough that's most known for. And so, yeah, it's definitely a larger thing than most people realize, but that's also the consequence of us being between two major populations, Austin and San Antonio, and of course, we have Houston, a giant port of entry for many immigrants who are coming into the country, where TB is more prevalent. And so oftentimes they get screened there. Sometimes, the screenings unfortunately may get missed or don't. We actually get every notification from the different ports of entries into the country. Whenever someone says, I'm going to go reside in Hays County, we get a alert if they are suspected of having TB. And so we get to investigate and stuff.
Wow. Interesting.
Yes. Very fun.
Is there any overlap between that and mental health or no?
So we've only recently started investigating the repercussions of kind of what that looks like on human health and behavioral health. A good example is now whenever someone's diagnosed with TB, typically, this hasn't changed. Whenever someone's diagnosed with tuberculosis, they go through an intensive treatment phase, which is a phase that they cannot, they're essentially quarantined and they cannot go outside their home, they are where they're at risk to the general public, right? They want to go outside, they can go outside. But if they're open to the general public, that we restrict them from that. And as many individuals who have ever experienced just having to be at home, it can take a toll on your mental health. And so what we try to look at is different things that we can engage them with, but also what resources is this going to impact them. Oftentimes it's a job. And so how do we make sure that they still have the job whenever they get back, but also how do we make sure they get food while they're going through this treatment? And so we've started partnering with our food bank to try to, okay, we know this person's going to need resources. Can we please get them set up onto the food bank roster so that way they can start coming through for food and stuff. So there are little nuances in which we've started to understand maybe there's a thing, some things that they're going to need help with that will impact their mental health.
Yeah. Interesting. And I'd like to go back, because I know we kind of skipped over it. I'd like to go back to the organizations in which predominantly that you might work with. And obviously working with the food bank and tuberculosis patients, what does the kind of mental health equivalent of that integration look like? Meaning, you're seeing more patients or you're seeing more people come in and kind of matching them with a peer support specialist. Are there other organizations that you work with hand in hand to kind of help the community?
Yeah. I would say our biggest mental health partner and provider is our local mental health authority. So that would be Hill Country. And we work closely with them. I mean, one thing I noticed when I first got into this role, talking to our indigent health care coordinator was because our indigent services don't cover mental health services, just physical health care. Where are we sending them if they have, do we even ask if they have a mental health need? So working on an MOU to develop a warm handoff. And so bridging those gaps. So especially right now, since we don't have the capacity or funding to be able to offer those direct services, finding the partners that can and working with them for those initiatives. So Hill Country would be a big one. Same with Texas Icon. They've been really great in helping us start to integrate Narcan into the jails. We're getting a vending machine there and also starting a process so that individuals, as they enter jail, will get screened for any history of an opioid use disorder or their risk level. And if they would like, they can opt into having Narcan placed in their belongings upon release. And so working with the discharge planner. So yeah, Texas Icon has been a great one. Partner as well. I'm trying to think who else. We have Outsiders Anonymous, who they have a really unique, approach to mental health, and it's that free nonprofit gym for people. And so again, creating these community spaces. So it's not just about medication or therapy, but again, holistic health, because we know that physical exercise is boosting all of the things up in the brain that you need to. So yeah, we're very grateful for them. I know, again, it's just a matter of getting creative with our collaborative partnerships. We're doing for June, it's PTSD Awareness Month. So we're partnering with Outsiders Anonymous to do like a Marines obstacle course day for that. And we're going to have some like veteran resources, and we're excited about that. So that's an example.
Yeah, that's amazing. And yeah, that's interesting. I'd like to take that and also move to data. I'm not going to ask you specific statistical questions.
Pop quiz.
Yeah, pop quiz. Because I know that we talk about data. It sounds like data is incorporated into every decision that you make, especially when maybe dealing with certain organizations and what data that they look, and to make certain decisions for county-wide services, you need data. We've talked about data a lot, about how you want more mental health data from a large perspective. So like what is the goal when it comes to like what data that you want or what data you might be missing? And how could people help if they can?
Yeah, so that one is definitely a tough one. I'm trying to think myself, like, right off the bat, whenever you ask, like, what data are we looking for? To me, it's like, how do we quantify the number of providers in our community? How do we get the data of how many individuals are being served through those providers? Just to get an accurate representation of, whether or not they're being utilized, but then also understanding what are the needs of our community. What are the most prevalent diagnoses, and how can we better create, again, like shared spaces or environments in which these individuals can operate. For me, it's also, again, kind of a cost benefit thing, looking at how much time do our first responders spend on a certain call related to mental health related issues. And then kind of doing a, fish diagram, looking at what was the source of that issue and where in our, continuum of care could that been intervened in order to not have had that crisis. And then again, it's kind of dissecting that situation from there. Okay, well, they couldn't get a social worker. Why couldn't they? How many social workers are prevalent in our community, and how many of them offer their services for free? And then, it's like, well, okay, well, they didn't have a social worker, but why were they in this situation? Oh, rent was very high, or, oh, I couldn't afford groceries, or I couldn't make this important medical, expenditure. And so it's all these little nuanced conversations for me that it goes back and back and back further. But currently at the moment, for sure, it's always going to be a, quality and quantity kind of thing. What level of care we were providing to our individuals and patients, how many providers do we have, how many individuals do we need who need these services, distance in between them, how long does it take to get an appointment, how long does it take to even get to that location, all these kind of nuanced things.
Yeah, we've been doing a lot of data collection for our peer support since we've been doing that trial to get feedback about what's working well, what isn't. So that's been very helpful. And whenever we have these new ideas that we want to present to stakeholders, to our commissioner's court, like it is just so important that we have that it is data driven, because we are investing so much resources and time into these initiatives. It needs to make sense, and having that to support it is very big. Another thing that I've think that's been helpful for us is looking at the map breakdown of city lines and what areas of Hays County, because, Dripping Springs is very different than the population of San Marcos. And so finding out what resources are located where, like you said, and having, especially with the community paramedic, is there a certain area of Hays County that is having high utilizer calls, and why is that? So I think too, it's easy to think of Hays County as a whole, but you also have to break down by the cities and then break down by, it just keeps going. So yeah.
Yeah, like in my head recently, I was talking to my parents about a new community, and like on east side of 35 off of Windy Hill, we're seeing like developments. There is obviously Sunfield, there's Porter Country, there is I'm trying to remember the name, but there's another one called Prairie Lakes, and so there's like so much growth over there, and it's like, what does the infrastructure look like over there, and what type of resources are they eventually going to need? And obviously, as things are growing, to me, what comes to mind is a food desert. There's going to be all those individuals who don't have access to food resources, but also the density footprint of those developments. How does that impact first responder times and whatnot? So it's always going to be a lot of quantitative data looking at, but also like Peyton said, looking at the peer support needs, kind of asking our internal partners what their that qualitative data from the experiences. That's also important to us because, again, numbers can tell a story and they can tell us, but like what to do, but that qualitative experience can help us dissect what the numbers are telling us better than what may be presented. And I think we've noticed that. I think in our needs assessment, there was a disconnect in one of the numbers and actually the perceived situation that was going on. I mean, specifically a difference in opinion between actual stakeholders and the community residents. And so it was very interesting to see that.
Can think of that with the youth mental health needs assessment too, that was done by Core 4. It was really interesting because they surveyed stakeholders and mental health providers and then the youth and talking about like what they wanted to see more of and what, sometimes adults think youth need is not what you think youth need. And so that was a really great survey that was done to kind of see what those gaps are and where there is overlap, how we can, because services are only going to be as useful as the population thinks that they are and will engage with them. So.
Yeah. And I would assume that that's like a big challenge that you guys are seeing is people think that they might know what the issue is, but then the data might be saying something different. Right. Or the actual population that it's affecting is, very different than the solutions that could be provided. Which kind of helps me transition to a question that I had prepared for you all, which I tried not to look at all of them, so I wanted to make it a conversation. But just thinking about what things have been really difficult. We've covered a lot of them. I mean, kind of differentiation or misalignment between needs or how there's not enough funding or that. But I'd like to maybe think about like within the population of Hays County, how many people actually work within Hays County? Is that an issue? Because people might work in Traverse or work in Bear and their minds are there, but then they come back and they sleep here, they play here, but then they go and work and make money in a different county. Is that an issue with like homesteadedness of people being here and wanting to reinvest in the county and funding? And I don't know. That's something that kind of just popped into my head, but I would love to hear y'all's perspective on larger issues, just like kind of macro.
Yeah. I'm like trying to put on my hat of like, what would the commissioners say, right? They're kind of like in touch with their communities and everything. And I think what you'll see is that we have a lot of transient residents, Kyle, sometimes is referred to like as a bedroom community because individuals really just kind of sleep here and wake up here and then they go back to Austin. And so it can be tough with that type of environment because, again, individuals aren't in tuned as much with their local government. Although it's kind of an issue for every local government, right? It's like, we wish our residents were like engaging more, listening more. But it's definitely an issue whenever, again, kind of what I alluded to earlier about being compared to the Travis County or Bear County. Sometimes there's that veil of ignorance, not in a positive or negative manner, just the existence of it. Some people don't even think about how there's a county line right there and that they exist within these differences. And so it's not something that sometimes they're aware of or think about. And so for us, it's how do we connect with our residents more and make them aware of it. But it's also, I know we heard this during COVID, but, diseases, viruses, or anything, they don't follow the border, right? They don't follow these imaginary lines that people created. And so, the biggest example is the measles exposure here in Hayes County. An individual came to tour and then, left. And then we kind of had to deal with, investigations and everything. But in terms of mental health, I know that it can be a challenge in trying to replicate the expectations.
Yeah. And I know I want to say a large portion of our staff graduated from Texas State. And so we've also been trying to get creative about ways to really engage with the wonderful wealth of knowledge and minds that we have here and keep them in our community and provide those opportunities, because I think a large reason too why people will go to Bear and Travis is like that's where your opportunities are. And so trying to be able to equip ourselves, our partners to be able to have these internship opportunities or ways that they can stay in the area and kind of continue to like give back to that area if they want.
Yeah. I feel like opportunity seems to be like a word that keeps coming up, is having more opportunity to stay, having more opportunity to give back, having more incentive.
Creating that capacity and
whenever you think about it, right, like almost every town or locality tries to create a main street, and it's because they want their individuals to provide more tourism locally, be invested with the activities that are going on. And so it's so easy though for the residents of Buda or Kyle to be like, I'm just going to go up the road. I'm going to go on Congress. I'm going to shop all the stores there, or I'm going to go to, the west side of Charleston. And then so it really is about creating the opportunities here that residents are going to be attracted to and find meaningful. But also it's about the demands and needs of our communities. So a lot of times we try to do community engagement events, and what we knew was that they need to be evening events, and they need to be evening events in which is for the whole family, that there's activities for, and that there's resources for the whole family, and provide food. Because, last thing a parent wants to do is come to an event that they're, having to provide their feedback and input and get back, and dinner's still not done. And so it's little things like that we have to provide a little bit more just to get that engagement, but it's worth having that engagement with our residents.
Yeah. For some reason, this is still stuck in my mind. I want to go back to it. Is walking and the trail and being outside. Is there a integration that you've done? Maybe is there a trail conservancy?
So there's Purgatory Creek and stuff, and I know that they're working on connecting.
Yeah,
right?
It's called. I'm trying to remember what it's called, but it's like the Great Springs Trail or something, and it's pretty much connecting Travis County, the spring that's in Travis County, through our local aquifer here in Hayes County, through Comal County and Bear County. And so between the four of those counties is going to be an integrated trail system that will eventually connect with one another. It's been a thing for maybe the past, I want to say decade, that they've been aiming towards to. I think we are seeing some progress on it. Even in the city of Buda, they have like a great master trail plan, where they don't have to rely on vehicle transportation or the only transportation modality. So, they can take their golf cart, or they can do pedestrian traffic or bike traffic through these trail networks to get to where they need to across Buda.
Wow. Yes. Interesting.
I'm excited for it. I grew up in Austin, so having Town Lake was such a blessing, and I miss that. And I've also been, I'm studying to be a counselor, and so looking into walk and talk therapy and just that aspect. There's so much research supporting how efficient that is, and how, especially with stigma of sitting across the desk from someone, not going to work for everybody. So having those alternatives. So I'm excited to see that come. And we've talked about wanting, our dream is to have like a little trail around the health department so the community can come. And
we really want a space where the community just feels welcomed, and they don't feel like, oh, it's local government. And like that's one of the reasons why we changed our logo, was because we didn't want individuals to see it and feel like this mental health duress of like, oh, like I don't want to go there because it's, the government. We want
who has what information and
because they get warm or happy feelings from the imagery. But as far as integration, I think that's one of the projects that has been a little tough too, because here in Texas, a lot of the developments are have little to no regulation, especially within the unincorporated area of the county. Really, as long as they meet the law or legal requirements, they can develop out there. And so there's no, from the county's perspective, no red stamp that's like, no, you can't do this unless you do this. So what it really relies on is the commissioner's knowledge, our knowledge, the community's knowledge to provide more input into how our community is shaped. One thing I try telling people get involved with is their local planning and zoning commission. And so I served on the Buda Zoning and Planning and Zoning Commission. Oh my goodness, P&Z. And I remember that was always a lot of the conversations anytime like a planned subdivision wanted to come in was, okay, but how are these communities going to be able to walk? Where in this can we have that? Where's the green space going to be at? How do we make this, less, just house? How do we create this into a space where somebody feels or can have this feeling of joy and completion in? And so, the conversations start there and start with those commissioners because eventually it will go to the city. And for the county, it's talking to your commissioners. Hey, I noticed that there is an X subdivision that's going to have 2,500 homes. Maybe we can talk about joint maintenance on the roads for the sidewalks to make sure that it's big enough for 2 people to walk on, or making sure that there's a park there. Things of that sort, to me, are really important that individuals are aware of, because again, that is the easiest way.
Yeah, I was going to say that's immediately involved in mental health and physical wellness. Being able to go outside and go for a walk is a privilege in itself, you know, and which is crazy to think about because it shouldn't. It shouldn't be. Really, we should be able to go outside and have have our feet be able to touch grass or have some space to play with your friends or play with your kids or go for a hike or something along those lines. Like that is so beneficial for every kind of part of the human wellness cycle. I don't know if that's the actual term for it, but it really is. Yeah, it is now. It can be. But yeah, and I wonder as we progress forward, if you would love to see the Hays County Health Department as part of like being involved in that in some way. Because as of right now, it sounds like you're not, and that's kind of.
Yeah, it's really. And so like what I often do kind of have this bill with people. It was like, oh, Matthew, well, like you just want public health in everything. Like I don't want it in everything. It is a part of everything. And so it's like, we just got to have these conversations on why it is, and like educating individuals and, either different department heads or elected officials, onto why it really does matter and how public health is the tenet of our life, again, because it's so much more than just infectious disease. It really is looking at how do we treat the community as a whole, and treatment isn't just medication. Treatment is, social interventions or, other types of physical interventions that may be implemented.
Yeah. The future. The next, we'll say the next 10 years. What's for now? 2025.
Yes.
So 2035. Hays County has 2 million more people. Maybe we'll see. There's a light rail system that connects Austin to, Bexar County. That's not going to be 10 years. That's kind of probably going to be a lot longer than that. What is the number one thing on the docket that you hope gains steam, I guess, in investment from the local politicians?
That's a good question.
Yeah. I want to say I believe that the local politicians have had a lot of realizations about public health, and especially due to the implications of COVID. And I want to say that they are starting to learn that, these things are a lot more interconnected than we ever thought. And the biggest example is animal welfare services. Again, that was just a recent decision where they were like, wait, why don't we have the public health department involved with this? And why don't we have them helping out with this? Especially if our goal is to have like one huge hub of welfare services at one location. And if we're going to put the animals there, why aren't we talking? And so for me, my vision is kind of that what's being worked on too, is a centralized department that has these different facets of public health in one. Because it's super hard to have an investigative body and a enforcement body, separate under different department heads or different leadership. And whenever they're combined, the work that you'll see is able to be, oh, hey, Peyton, I saw this issue at X place, I'm dealing with the repercussions, but do you mind going and intervening for this? Mm-hmm. It's a lot easier whenever it's in one department versus, 4 different departments. But at the same time, it's recognizing that those splits can happen, and it's about education and partnership. But again, for me, I would hope that they invest in a centralized unit of government that is public health centered, able to address, again, one, health, environment, animals, and human health, and where they're provided the resources that they need. Because right now, our total budget is maybe $2.9 million, and $2 million of that is a contract to Indigent Health. And so whenever you look at that, that's only $900,000 for a county of almost 300,000 individuals is the funding for public health. And to go back to your number, this is something I'm fully aware of, is we're already approaching 300,000 individuals in Hays County. I believe we're going at least 3 to 4% every single year. And so what we're going to see is by at least 2030, we're already going to be in the 400,000. And then by 2035, we may soon be approaching the 500,000 number. And so you already hear concerns about water conservation, especially in how it impacts our county. What does that look like? We're already seeing growing numbers in the homeless population.
Yeah.
We're seeing issues in our sheltering. And so if we don't act now, those issues are going to be worse. And so it really is, to me, this vision of we need a centralized unit that focuses on everything public health. It's fully invested, and it has a hub that everybody can go to in person. Because right now we never thought we were going to in 2023 when we purchased the building, but we're busting out the seams.
Yeah.
And from a mental health perspective, what do you think?
Yeah, I agree with a lot of what he said. Is more prevention, upstream solutions we need to be building, not to meet what our need is right now, but what we know is going to be. Mental health, behavioral health wise, having that integrated into all facets of departments, and to kind of what that actually looks like. Peer support. We could have a team of peer support specialists, and they work with the judicial system. They work in the jails. They also are in community, because as we know, people don't stay in one spot. They move. So we need to have these hubs and these teams that can move with people wherever they are at their life. And that's warm handoffs. It's really that, just addressing the continuum of care. And I want that for crisis services. I want it for every kind. So more of that integration also into primary care settings in schools. I mean, that prevention mindset of let's detect a mental health issue at the earliest point possible is really important. And so working with our primary care providers, because a lot of people won't go see a specialist, won't go see a psychiatrist. And so if we can equip some of our primary care providers to be able to do those initial screenings and have those flows and webs, that's what I really think that there's so much power in, and what we'd like to see.
Yeah. And a good example, kind of what Peyton was saying about, intervening is, we're the 2 peer support specialists that we requested. Our hope is that they would be helping with recidivism. So making sure that individuals who are coming out of jail stay out of jail, and not so much from a bad is bad, but it's multi-beneficial. 1, it saves the county money. 2, it helps our, county economy. Individuals who are in jail aren't helping out with the economy. But then 3, it helps an individual get back out into life and experience what life is without being incarcerated and integrated back into society, whether it be through a job or whether it be through organizations and activities, but some healthy output that's best for them. And so something like that, we're requesting 2 positions that will maybe total in $100,000 for like salary and benefits. If it can even keep out 3 of inmates from returning, that's the savings right there. And so it's little things like that.
Yeah.
Really, we want the local elected to invest in more of the solutions. So that way we can catch it early on. And again, those cost savings will eventually happen, but it needs that investment to happen
up front. Yeah.
Yeah, absolutely. Well, I know we're coming to a close. And I'd love to end on one specific topic, which is both of your career paths. We're all in the earlier parts of our career. And I feel as though there's not many people around our age that are investing into their communities. In seeing you all as inspirations, leading a health department and graduating college in 2021 is a pretty amazing. Honestly, it's a very amazing feat. And I guess I would like to hear from both of you, like, advice to a younger generation for potentially why looking at public health as a potential career path or potential something to stay cautious about is important, because I fear if we try to offload it to just being a private issue, we're never going to solve any of these issues of chronic health or mental health, or the disparity between those who need the assistance and those who have the access to the assistance is going to continue to get larger and larger. So just love to hear a couple of like kind of perspective or words from both of y'all's backgrounds.
Yeah.
You want me to start?
Yeah.
Okay. Yeah, sure. So
she heard the Austin Public Health Director, Adrian Spur, talk at our recent public health symposium. And so she kind of had some words of wisdom. So.
Yes, we both got kind of teary-eyed. She was really good. And I think, to go off what she said, like, I think it's so important to be grounded to your why. I personally have experience with mental health issues. And so that kind of is what drew me to pursuing a license in clinical counseling. But again, I felt like I wanted to take what I know works at an individual level and try to apply that systematically. And I think we need more people that have that individual understanding of clinical mental health counseling and social work principles shaping government. And so when I met Matthew and he kind of had this holistic vision, like, it just really spoke to me, and that's what drew me there. I think being grounded to your why, and then also progress over perfection, is like something that's really helped me in my career, as well as having a mentor or having these people that you can bounce ideas and the energies there, because it can be very discouraging and slow progress. But, I always say, like, it's about going in the right direction, not how fast you're going. And so it's those little wins and celebrating those. That's kind of like a conglomeration of like little things that have helped me, and kind of a short overview of mine. But I'll let Matthew.
Yeah, I think mine, so my dad growing up was a trustee for a local school board in a town it was a tri-community thing. So I think the school total maybe had 100 kids. Maybe that's a large number even for right now. And so seeing him in local government, but then also my mom worked for the county growing up, I always had this sense of I want to get back to my community. But then going through college, it kind of opened my eyes up to some different perspectives of what does that look like? What do the career opportunities look like for me? And so for me, I was like, I want to go into city management. I love problems. I love, fixing things. And I think anyone in the county will tell you, like, if you give a problem to Matthew, he's going to try to work on it. But then COVID happened, and I started working as a pharmacy technician at CVS. And I was like, hold up, like, I kind of really like, helping people. And why isn't my local government doing more? And so I was like, come on now, like, this should not be a hard thing. And that's whenever I came to the awareness of local health departments existing. And I was like, okay, well, what are they doing? And, how can I help? And rather than like be Christian person, I asked myself, well, I need an internship. The local health department probably needs help. I'm not happy with the current situation. Why not go intern and see how I can help out? So I think I probably am one of those people who really kind of have that mantra of like, if not me, who? And so that's kind of guided my career. If I don't do this, who will do it? And how do I make sure that I am not an individual who is going to be a part of the bystander effect, where we're seeing things happen amongst us and, we're there and we're like, this is wrong or something should be happening. I chose to want to make sure to prevent that from happening. And then growing up in the community, I grew up in Caldwell County, which is the neighboring county of Hayes County. Everybody's local here. Like, I think you can ask Peyton, there'll be times where they're like, I know your mom, or I know your dad, or hey, like we saw each other or we grew up together. And so there's a real investment for me here in this community. And I think seeing that, it's really like, I want to give 110% to this community because I want it to be my home, but I want it to be other people's home. And there's real people here who I deeply care about. And I know that they have a father, they have a son, or they have a mother and daughter. And so I guess it's also that empathy that leads me. And I think that kind of goes into that whole public health space. I remember one of the things that a good mentor of mine, Elisa Garza, she's city councilor for the city of San Marcos, but also an alumni of Texas State. She told me about, forgot where I was, hold on. How are we going here?
Alyssa Garza.
Yes, we had talked about the fact that individuals need these spaces and everything, and that we should be driven for these things, and that we need to have more individuals listening to our community. And that oftentimes, here we go, this is where she was going at, social work or social sociology theories typically started in public health. And it was because of that data correlation that they started seeing these trends happen at ease inequities. They would throw out a theory and idea, see if it worked, and eventually it got adopted into mainstream practices. And so, that kind of stuck with me is, how can we, our county, be on the forefront of what's happening? And not from a sense of, I want to be credited for that, but a legitimate, why am I going to do the things that aren't working? And why am I not going to be doing the new promising activities or evidence-based practices? And so that has kind of just been, I guess, like a blessing in itself that I'm driven for that. But also, I alluded to it earlier, that my recent recent graduation or exposure, it allowed me to bring in new perspectives and new ideas in education that in the field isn't happening. And so I'll give an example is I applied to a position at APH, interviewed, and, they're like, yeah, like a lot of our people have 15 years of like tenure here. And it's like, that's amazing. And it is great. Like, and that means they have a really great culture, a really great work environment. But it also means, there is a limited perspective of the new changes in public health and how it's coming, especially if continuing education is not a component of that work. And so I think I've told my staff, like, I'm going to always put their continuing education before my own. But at the same time, I recently denied one because I was like, I was thinking of going to a conference. So I need to be just as educated as y'all are. So, I definitely think that's something for me is I'm a constant learner. To no surprise or surprise at all to some people, I'm even still considering going back for my doctorate.
I mean, he did planning and zoning committee for fun. Like, who does that?
And so I think really it is that idea that I want young people to take away is, if not you, then who? And, you have to be that active decision maker within your life and for your community, because there are going to be other people like you in your community who are going to be like, I wish that was different. But if you're not implementing it, who is going to? And that kind of has been my whole mantra for the work that I do.
Yeah, I love that. If not you, who?
Yes.
Yeah, I think that could really change people's perspectives for the better.
Yes.
Or else we get lost in that bystander effect, which is, potentially scary to be around an entire community that potentially is that bystander.
Yes.
When we need people taking initiative in ways that help themselves and others.
Yes. And it's not to say like, again, like nobody should want the credit. Some people will. To have that mentality for that you're doing this with the expectation of no return. Oftentimes in local government, but you won't find that. But it does pay off whenever you get to see the impact real time. Like, it really is amazing, and having that mentality, because you do get to see the benefits. Oftentimes I know Peyton and I, not me, I see the results, but Peyton will often be like, what's happening? I don't see anything. And I'm like, no, like there is so much that, like, again, no budget, my person. And it's like, you did all this. And again, it's because we took the reins and we said, let's do this and let's figure out how we're going to make it work. We are finally going to have a contract signed after a year and a half in the making. So again, it's that idea of, if I'm not the one who should do it, and not from a sense of like, I'm the only person who can do this or I'm the right person to, it's who else legitimately would do it if I'm not the one to speak up right now.
And surrounding yourself with people who think that way. Because I think that that's been our momentum at the health department, is like our whole team has that
vigor and desire to accomplish. I remember a conversation with Kate where she was like, Matthew, what do you think about, XYZ? And I was like, oh, historically? And I was like, I don't like that. I was like, go ahead and tell me, convince me. And then I was like, yeah, like, let's do it, because again, if we get stuck in that idea of like historically or what,
this is what it's always been, what we've done.
Yeah.
Just do it. If you're coming here telling me I want to do this and I see a way through it, do it.
Yeah.
So, and it's embracing that. And so, I think I would lead with our young people again, if not me, who, but also never say no to an opportunity, again, with mental health in mind. Don't burn yourself out, but know your limits, know your capacity, know where that opportunity is a good one, and just do it. Get out of your comfort zone. Yeah. I think that has allowed really Peyton and I to thrive in a lot of what we do.
Mm-hmm. Yeah, amazing. And I'd like to go back quickly to what Peyton was saying, something along the lines of that's really stuck with me, which is like, you can't see the progress until afterwards. Mm-hmm. And, I've talked about this on the podcast as well, but like, I'm also going back to school. We've bonded over this for a long time, but, also going back to school to be a mental health professional. And it's daunting. It's a long program. Yeah. And it sometimes feels like it's never going to end and so now I tell a lot of my friends, I'm like, just so you know, if you ever go see a therapist or a licensed mental health professional or a licensed mental health counselor, just know that they have a lot of schooling. They put in
so many hours.
And I think that's important for a lot of us to hear, because, I might be speaking to a future version of myself that needs to hear this, but like, we like to see immediate feedback. And y'all's world within the health department is so not immediate. Yeah. And I think that's a really interesting perspective, because, now with so many things moving so quickly, it's like, okay, how does this dollar translate into this thing immediately? Right. When it's like, no, we're aiming for 50 years down the road, or even with our programs, like we're aiming, after we graduate, then we do our, associate license. And then eventually 5 years down the road, we are able to, operate independently. Mm-hmm. It's just so interesting now thinking about that perspective, because I feel like the younger generation is so immediate in that gratification. So thinking about how we might need to incorporate that.
Yeah. And I've had to reframe like the way I think of progress, because I remember one meeting specifically that it felt like nothing got accomplished. And I was telling Matthew about it, and he was like, spinning your wheels is part of the process. Like that, having that conversation is part, the storming phase of that group work is what we go through to get to the next phase. And so thinking of it as like, oh, that was a step. And thinking of it as having this conversation, planting that seed. If they were at least a little receptive to this, or we started that trajectory, like that is progress. And so that mindset has helped me a lot feel better about, even if it's not a tangible thing that's enacted right now, things are happening. And so that mindset shift, and with school too, thinking of it just in baby chunks and be like, that's one thing at a time. So
yeah, well, I think it's a good way to think about, politics in general.
Yeah.
Like with politics, making any sort of decision, if it is a baby step moving in a certain direction, because it takes a long time to move an entire community to view something, or to kind of move in lockstep in a certain direction. And we have to recognize that it's going to take a lot of time to do that.
Yeah.
Yes, it absolutely will. And I think one kind of like have a good mentor boss, who can help you out with those situations.
I would be gone. No, if it wasn't for him.
And then, but also the idea like that, it's okay to have like, I loved, it's cheesy, but those things where it's like, what is it called? Like the spiral, right?
Oh,
Where like you see yourself like, you don't know where you're going, but you're just not looking at it from the right
like the perspective. Yes.
But also ground yourself. I tell a lot of the interns when they come in, do not expect to leave with your degree and be in a management role or to be, these expectations unless you meet these qualities. And it's always gauging yourself, not to a detriment of your mental health, but to ask yourself, okay, like when I create this 5-year plan in 5 years, where do I want to be at? And, how do I make it appropriate for everything that I'm currently doing? And how do I have those conversations with my boss? And so like, I know Peyton and I've had some of those conversations. We were actually talking about it, before we got here. My hope for her is to have a division in the health department, be the division manager, at some point in time, assistant director, something like that sort. But we've also talked about that behavioral health, it may just be incubated in the health department, and it may at some point be its own department.
Yeah.
So it's having that vision and realistic expectations of everything. And it's definitely something.
A roadmap is important.
Yes, having that roadmap is very important, but also having your cohort of friends. Like I know y'all probably have a cohort of graduate students that you are with, and sharing that experience with them. Like I have a friend who I'm still in contact with from my cohort, and it's like we constantly will just ask each other, like check in every now and then, like how are you doing, and like where are you with yourself, how's things going with your work. That cohort really does help.
Yeah, absolutely. Well, I think we're at the end of the time. So Peyton, Matthew, thank you so much for coming in. I'm sure this will be a first talk of many as we progress forward. But I always like to end with like the easiest way to get in contact with you, or where to visit, or any sort of like contact information.
Yeah, so the easiest place to visit or like get in contact with me is going to be our website. So hayescountytx.gov/health-department. And then there will be my department and my contact information. If you go to behavioral health page that's on that website, it'll take you to Peyton's contact information.
You can also follow us on Facebook.
Yes.
Plug us.
And hopefully soon Instagram and Twitter, some sort of X, whatever. However, whichever generation you grew up with. But we're hoping to get some social medias there. Hopefully it'll be a platform that will be able to experience us on.
Great. Yeah. All right. Well, thank you so much. This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.